Now you can hear me, I think.
Can hear you, Chris.
Okay, perfect.
I can hear you, Chris. Can you hear me as well?
I can. You say Britta for some reason.
That's interesting.
I can try to rename you, Lori. Let me see if that'll work.
Let's see. Can I rename? I'm going to try rename on my screen here. Lori Peterson. Oh my gosh, that was easier than we expected.
All right.
So Chris, what I'll do is I like to start the webinar, just a quick little thank you for coming.
Absolutely.
And a little bit about the webinar, and then introduce you and turn it over to you. And then I will be here to support any questions and answers that come through.
Perfect.
Yeah, somehow, why did it do that? Yeah, our attendees are starting to join the webinar. Thanks for joining early. We're going to get started a little bit after 3 to give folks enough time to log in, and then we'll get started.
Perfect. And then do we control the slides on our end? Will Christopher
Yes, you're
those? Okay.
You're panelists, and
Yes.
you will be able to control the slides.
Okay, wonderful.
If you'll let me know when you want to advance, Ms. Peterson, I am ready to do that.
Okay, sounds great. And I would
All
love
right.
to see the speaker notes if we're able. If not, it's not critical.
I believe I can send those to you. I will do that right now, and then after Dominic introduces us, we'll go live.
Okay, sounds great.
All right.
I'll be back in a few.
Thank you.
Thanks everyone for joining today's webinar. We'll start in about 3 to 4 minutes. Thanks everyone for joining today's webinar. We're going to get started at about 60 to 90 seconds. Thanks for your patience and for making time out of your schedule to attend today's event. Welcome everyone to today's webinar, Funding Everywhere and Not a Cent to Spend, Navigating Recent Federal Grants. This webinar is sponsored and supported by NACCHO's Diamond partner, AM Trace. Public health professionals from the leadership of AM Trace will discuss their experience from the front lines as government employees. There's lots of funding and money out there right now, but actually getting to it can be confusing at best. And through this webinar, we hope to show you some ways to access the funding with our partner, AM Trace. My name is Dominic Kettlefemo. I'm NACCHO's membership manager. We're glad to have you here today. We're thankful for all the work that you do day in and day out to support our mission for improving the health of your communities by strengthening and advocating for your health departments at the local level. NACCHO is the only association dedicated to serving local public health departments in the United States. If your health department is a member, all staff within the health department receive our NACCHO benefits. For any questions about this, you can just ping me in the chat box, or email membership@naccho.org. And now I'm going to turn it over to Dr. Christopher Orlia and epidemiologist Lori Pearson, as they will share tools and opportunities that might lead to collaborations and funding for your local health department. Chris, the screen is yours.
Thank you so much, Dominic. Let me bring up our presentation. right. Dominic, am I on the right screen?
Yes, you are.
Okay, perfect. Good afternoon, everybody. Thank you for joining us. As Dominic just mentioned, I am Dr. Christopher Orlia, and my colleague Lori and I are beyond pleased to have this opportunity to join you today to hopefully increase funding that exists somewhere in the ether that we all look for day in and day out. So by the end of this, we hope to reach a couple objectives, and I think the biggest one on everyone's mind and that we're hoping to convey is that you leave feeling better equipped, not to only locate, but the processes to go through to acquire those funds. AM is a Diamond sponsor, pardon me, a Diamond sponsor and partner of NACCHO. And without further ado, let me begin into our presentation with a short 60-second clip of what we have available within the AM Trace world.
Not hearing any sound. We're working on the sound issue, everyone. Thanks for your comments. Please be patient. Technology isn't always as readily functional as we'd like it to be. So we're working on getting the sound fixed.
It is. Thank you for that, Dominic. I thought the audio settings were where they needed to be, but I can assure you I'm much better at public health than I am at IT. So with that, we'll move along. As I mentioned my name before, Dr. Christopher Orlia. I am a master in public health and certified in public health. My undergrad and master's degree, I'm very proud to say, is from Texas A&M University, Giga Aggies. And I also achieved my Doctor of Philosophy in Public Administration with a focus on public health and policy implementation through the University of Liverpool in England. There I focused primarily on a nature versus nurture concept of would legislation be a strong enough tool to provide for a sturdier or more resilient outcome as far as health elevation is concerned. What I found was very, very interesting and documented in my dissertation that although there can be and are many flaws in all government systems, the way that the United States administers public health could certainly be elevated. But as a premise, I found that punitive measures weren't as strong as nurturing efforts could be. So I was very excited to see that we're at least on the right path with the way that we all work here. I do have a background of roughly 20 years in local government administration. I'm very happy to have lost count of the people that I hope have made a positive impact in their life. And I've worked strongly within emergency management during that time as well. I am a Houston native and on the Gulf Coast. For those of you that share my geography, you're very aware that public health can have long-lasting implications and ramifications from weather events that we have. Hurricane Harvey was very recent and probably the most topical for our public health teams in the region to discuss. So I also bring a background of national incident management systems and the incident command system structured by FEMA. So I like to bring both of those sides when I'm able to work with other folks. When I'm not with others, I can't think of a more fun day than spending some time with my beautiful wife, Melinda, of almost 15 years now, and my little mini me, Ryder. I have a 6-year-old son, 6 going on 26. Any chance we get, you'll catch us near the water. We love fishing and just general traveling, so at a beach. So that is a little about me. Hopefully enough to realize that I'm somewhat informed on what I'm talking about and also a real person too. So I'll advance to the next slide and let Ms. Peterson introduce herself.
Thank you so much, Chris. And thank you so much to NACCHO and all of you for allowing us to present this webinar. Chris asked me if I'd like to share information that I've learned throughout my career as a geneticist and an epidemiologist. And I've been lucky enough to be able to work in the laboratory to find new drugs and diagnostics using technologies such as PCR. And I think we've probably all heard about PCR these days because it's one of the tools that's used to test for COVID-19 in some circumstances. I've also had the opportunity to conduct vaccine research while at the University of Washington and the Fred Hutchinson Cancer Research Center in Seattle. And this was HPV, human papillomavirus related work. I've been part of large and small epidemiologic projects to assess infectious and chronic diseases, the opioid overdose epidemic, and to conduct clinical trials as well. And in all of these endeavors, I've been involved in competing for funding to support the projects. So this work has included work at the CDC and the American Cancer Society, both of those headquarters in Atlanta, county and state Department of Health's, pharmaceutical industry, and the National Institutes of Health, NIH, in Bethesda, Maryland. And even at the NIH, we competed with other NIH programs for funds called intramural funding. And my work in the pharmaceutical world was supported by federal grants as well. And these funds were obtained through America's Seed Fund programs, often called the SBIR or STTR program, the Small Business Innovation Research Programs. And there are many federal agencies that support this program: the NIH, the Department of Defense, National Science Foundation, the Department of Agriculture, USDA. Oh, sorry, I was reading one of the notes here, and the EPA, the Environmental Protection Agency. And at the NIH, I was involved in writing and awarding federal RFPs, so I have some background there as well. I'm so glad to have this opportunity, and maybe we can put our heads together and come up with some ideas for how we might collaborate on projects as well. And we greatly appreciate your expertise and input. And back to you, Chris.
Thank you so much, Lori. Gosh, people say that they don't want to follow another person. Now I'm slightly embarrassed of going before you too. That was fantastic, Lori. She's such a phenomenal colleague to have. Telling you a little bit about AM, we are incredibly proud to be a diamond sponsor for and with NACCHO. And I think what sets AM apart and what made me leave 20 years of incredibly happy public service was actually being a client of AM when I worked in a city in the Houston metro, and AM was able to provide sources external to the knowledge skill set that we had internally. And just to see a firm that cared and that put people first. I think as public servants, we always have such a skewed perception of what the private world can be like, and that we do all of the good as public servants, and we do, and not to take any of that away. But I was very, very excited to find that exists elsewhere too. And within that, AM as a company started a little over 10 years ago with our CEO, Dan Gabriel, who began this company after a really exciting career that he can share with you at another time with the CIA, doing strategic communications and providing counterterrorism work, primarily in the Middle East and Northern Africa, and utilizing public health as an indicator or a determinant of just general welfare, I would say, around the world, and then brought that passion and knowledge within health IT and began AM LLC. And from that, about 15 months ago, when the pandemic, I guess, started to emerge throughout the world, and we realized that the epidemic within Asia was quickly becoming a pandemic, our CEO had the foresight to rally the troops and begin an organization that started with about 3 people sitting around a table. And now we're very proud to say that from coast to coast, literally within Alaska to New York. We employ a little over 1,000 people. We just signed a contract with a new school district, hiring 105 new people on the West Coast. Very, very excited. Within all of these accomplishments, we're proud to maintain a hub zone designation, which we can go into a little bit later through some of the purchasing jargon that will help bring you up to speed with. And you'll hear AM and AM trace used interchangeably throughout the presentation. The parent company, for a lack of better words, but probably not the corporate correct jargon, but I'll still use my my public servant hat to get away with that. The parent company, AM, works primarily in health informatics and in the federal space, with the primary clients being the Veterans Administration and other HHS affiliates. And then the AM Trace that primarily works with local public health jurisdictions, K through 12 partners. All of us on these calls works within case investigation and contact tracing, the testing space. Now with vaccinations, primarily right now, the primary target is looking at some of the new EUAs that have been allowed through the Pfizer vaccine that allows for some younger applications for the 12 to 16 age demographic, and utilizing some of our skill sets for mass vaccination and the K through 12 world to look at those. And so in those past 10 years, the teams work to support contracts within the federal government, and the rest of these information bits that you can see on the slide, we are incredibly proud of. So that's a little bit about us as an agency. So the types of things that we have done in health information technology, as public servants, we love to use acronyms, and everything through A to Z that you see in the federal space, we're very lucky to be a part of within the health IT world. There are several very large projects that exist in the federal space that we joined. The CIOSP 3, now 4, is a large endeavor that our firm participates with, will hope to participate with. Also work within infectious disease prevention and mitigation, vaccination and hesitancy programs. The next I'm particularly excited about is surveys. When we think of research, I'm glad to talk to this group because it really takes a team of epidemiologists to appreciate the power within a survey. If a survey is done right, the primary research data that comes out of that is phenomenal, and it can be easily collected if done right. And I want to thank so many of you that recently participated in a survey that Dominic's team was kind enough to help us put out into the public space within public health. And within that, we looked at contact tracing as beyond the isolated use of it within the COVID-19 pandemic. What use does contact tracing have? We know it has tremendous power. There were decided changes in the life amplitude and longevity within the pandemic because of contact tracing. And so as our research is looking into this further, how else could we use this? Could this be used on smaller scales within K through 12 settings when, as parents, we know that when a friend has strep throat or a friend has flu, we know that's terrifying because until very recently, most people didn't know what contact tracing was. A call from your health department typically indicated an unfortunate encounter, maybe with a sexual partner from an STI test or things along those lines. It wasn't as prolific for the types of data sets that we're getting now through that type of data. But right now we're doing that type of research. So thank you all that participated in the survey. And we were excited today to provide a scholarship to NACCHO 360, which if you have not registered for, I would encourage you to. 360 is going to have an abundance of really great presentations, and one person will be going. Thank you to our CEO for providing that. We do provide analysis and evaluation as well through an incredibly robust team of PhD and master's level data and health informatic analysis team members. We work primarily within a Tableau environment, allowing us to use large sets of raw data, still maintaining PII and PHI compliance under the HIPAA Act, but building custom dashboards that allow us to share with clients at a glance what people have put days, if not weeks, into correlating or involving some type of regression work into. We also do community outreach, which is right now proving to be incredibly helpful based on the targets that we're looking for within vaccine hesitancy. Health disparities, research. Right now, our team is researching some of the indicators and factors within long haul COVID and what the outcomes may be of that. We're also working within strategic communications, and those are available with international expertise as well. Some of the clients we've alluded to earlier are health departments, schools, both K through 12 and university level, long-term care facilities, which brings in a lot of Ms. Peterson's expertise in hospital-acquired infections, dialysis clinics, and community-based organizations, or CBOs. So now we start with the grants, what we all came for, caution red tape. I got very excited about getting to write that because for once I wasn't the one applying it. So I wanted to start with an example of what you might deal with through some of this money that's available. What people may not understand when you're in your role at an LHD is that they see on the news that there's $8 gazillion as far as they're concerned available, but you're telling them that you don't have the funding to provide X, Y, or Z for them. Well, because what it looks like to them on the news is very different from what it looks like to you. This is an actual scenario that I went through with some of the funding from the CARES Act. So just starting with the beginning, Congress ratified a certain amount of money within the trillions when we originally began this. So that money via the feds through our legislative protocols came out administered under the heading of the CARES Act. Well, we were nearing the expiration of the CARES Act, so we did what any good bureaucrat does, and we deferred it. So we put that into what was then called the HOPE Act. The HOPE Act then allocated money through the federal system to the states. I'm in the Houston metro, so my state, of course, is Texas. So Texas then was allocated a certain amount of money. And then that's still not enough. It's in your state, but it's not to you. So if you are in the Houston area, your council of governments is the Houston-Galveston Area Council. Many people don't understand that there are invisible layers of bureaucracy even within those that are seen. So the Houston Metro Council of Governments, Houston-Galveston Area Council, then received that large allocation from the state of Texas. In my particular jurisdiction, that was then converted to something that was referred to as the LIFT Fund. That fund was partially managed and allocated by a Type B Economic Development Corporation. In Texas, there are Type A and Type B, really similar to most other states. And then that money was recommended by a Type B Economic Development Corporation to be dispersed. And the ratifying powers resided within the elected officials, in that instance, a city council. City council approved, and then a final awardee, which in this instance were local businesses, to those that had already utilized or exhausted the PPP areas or weren't eligible for SBA type loans, received this money. Some of these were able to use this from things as simple as just getting out of arrears with utility companies to paying past wages after additional funds had been exhausted. So this is mind-boggling that it goes through this level. But all this is to say that no one is ineligible de facto or per se for really any dollars. The systems aren't set up to work against us as LHDs. The systems are set up with appropriate checks and balances that when you have the opportunity to spend a lifetime, which most of us don't, learning how to navigate them, they make sense. So what I want to do today is, now that I've shared this and eyes are being rubbed and notes are being taken, we'll progress to a point to where Ms. Peterson can help share how some of these mechanisms and tools can work. Because really all I've done in this scenario here is just explained a couple tools that don't circumvent or work around any stopgaps or barriers. Instead, they're tools that allow us to provide for a more seamless flow through and not rely on sometimes extended deliberation periods that can happen at higher levels. basically federal money made its way to a local municipal recipient in just a matter of 6 to 8 weeks versus I know I personally filed my income tax return at the end of January, and those came back a couple days ago. So 6 to 8 weeks from the federal government is I think a goal that we can all go for. So looking at a grant, what's in a grant? This this graphic that my apologies to Mr. Catalfamo, who did let me know the resolution wasn't quite high enough, and I thought I had fixed it, but we'll share out a copy of this to anyone that would like it, and we'll have this touched up a little bit. But this icon is available from grants.gov, which is a tremendous resource that Ms. Peterson will share a little bit further in the presentation. And looking at this, I think it's important that you look at the grant process as a cycle, because it is cyclical. When you begin the process, you don't have to necessarily prepare or be ready to forever be in this, but instead you should be ready to forever or always be available to receive funds through some simple checks and balances. Many of these funding opportunities are ongoing. So when we think about this, starting at the top of finding the funding, in the example I gave earlier, we knew the federal government had funding available. And then we're going through the circle, coming out, negotiating awards, which that's a little bit loose language, because I think if negotiation were appropriate, we would always want more and get it. Not always the case though, but the important piece is when you see that arrow change color from pre-award to post-award, that just lets you see where some responsibility kicks in, that these aren't necessarily hands out. And that's why some of the red tape makes a little bit more sense earlier, because you realize this is my money and your money, as far as taxpayers are, that we're getting through. And then within that wheel, what we saw there already was some jargon that maybe doesn't make sense. Looking at some of these here, I mentioned earlier that we are very fond of acronyms. I still find if you work in the emergency management realm, you're aware that there's a fat book, a federal appendix of acronyms and terminology. Kind of silly that we use things so extensively, we have to write a book of how to interpret our own language. I think that speaks volumes to the way that we do things, but if you can appreciate that, then that'll help move into these next pieces. Starting with a NOFO. Even as a 20-year veteran of working in public service, I had no idea what this was. And Lori and I went to the same universities and are from around the same area. So from the first day of work, we knew we were going to be buddies. So when she tells me, hey, there's this really great NOFO coming out, naturally you want to look important when it's your first week on the job. And I had to nod and say, oh yeah, NOFO, that's fantastic, I hope. And I had to get on Google. It's a notice of a funding opportunity. Many people don't realize things like this. And what's important to us is we deal as public health officials so often with the CDC, and this is the CDC's go-to language. So when you get an email that says CDC NOFO, well, that sounds like hoopla. You don't know what that is. Okay, something else from the CDC, delete, moving on to my next one. It's important not to. And I will tell you that it may not be entirely in the semantics, but some of these through their presentation don't even garner enough interest to create competition. Lori offered services several months ago for a non-competitive CDC proposal. What that means is if you wanted money, you just had to tell the CDC and that was it. The paperwork was minimal. To paraphrase, we as AMLLC were so interested in making sure that local health departments got the work, and we'll get into this a little later. It's not a quid pro quo, that's not even legal. But we had no one take us up on this offer. One person responded and they were from a county of 10,000 people, which wasn't even eligible. So there's power in knowing how to speak the language that these funders will speak. So this is just a sample of some of the things you might see. Lori will talk to that a little further later. I notice here that we're coming up on the 25-minute mark, and I want to move through this enough so that Lori can get into some of her details. So as you pick up a copy of this presentation, pass-through funding is one of the most powerful mechanisms that I utilized throughout my service as a public servant. What this allows is large organizations or large jurisdictions, even state or multi-state cohorts, think East Coast, the tri-state area, those agencies that may be eligible for these, but you're a tiny city somewhere outside of a city, suburb, what have you, you can still get some of these funds as a subrecipient. So there would be a prime awardee, maybe that larger jurisdiction, larger agency, and then through pass-through funding or a pass-through entity, you would still be eligible for this. So I hyperlinked a blog post at the bottom that I think is probably the most concise explanation I've ever seen of this. And I would really encourage you to take a look at that, particularly if you're a smaller health district or a smaller municipality or county. This could probably be where you could realize large gains as far as funding availability. So what does that look like for you as a pass-through? One of the first and most frequent obstacles that I saw in funding opportunities were nonprofits only. Well, as a health district, you are probably either a department of or a direct affiliate of a municipality, or in some way, shape, or form, your political jurisdiction of your own. What that means is you're not a nonprofit. So while there are many of those out there, a lot of us that need this money are not. So something that worked within my career, and many others have done too, is having what a lot of people have kind of colloquially referred to as a friends group. Libraries they've cornered this market. They're tremendous at it. What you can do is find a passionate group of people that maybe are retired colleagues or folks that have just benefited greatly from the types of services that you offer, to start these types of nonprofit friends groups or allies of your cause. What they're able to do is, once the incorporation as a 501c3 or whatever that alphanumeric combination is that matches their IRS identity, they're eligible to apply on your behalf for these. I hyperlinked a really great group. I would have to say I'm a little biased because this group provided funding for some of the work that I did as a public servant. But what they were also able to do is provide the assistance that we needed to make a lot of this work happen. So there are some articles of incorporation on the foreverparksfoundation.org website. I would encourage you to maybe take a look at those. Use a network of resources. Take a look at interlocal agreements. There can be times when a political jurisdiction may be a large HOA, if you live in a large enough area, that have lids that collect money, levy incremental districts, or MUDs, municipal utility districts, and the name of their game is forever staying in debt. Those types of interlocal agreements would allow pass-through funding to you as the end recipient, and usually the squeeze for the juice might be no more than marketing or a substation if you're an LHD that could provide services on a pop-up basis in high need areas. Then we'll go a little bit more into the latter of these teaming agreements and RFPs, requests for proposals, and the like a little further on. And keeping in mind that help is always just a call away. We've got several resources available to us at all times, depending on who or what we are as a jurisdiction. So grant assistance agencies for the day-to-day individual, maybe you already are a friends group, or maybe you're non-affiliated or a former professional. These two resources are amazing. So GovGrants Help is starting at the very beginning. If you just want to be a good citizen or are a public health professional now and have good citizens coming to you that maybe have a background in writing or just want to be helpful, this is the type of website you can send them to work on your behalf. The second is being from Houston, the Houston Chronicles, our local newspaper, and they always have these really great workshop type inserts. And this is a grant insert that came out that primarily targeted local government grants. And within that job description, it helps tell you a little bit about kind of the things you should expect, what you shouldn't expect, so forth. And then once you move beyond some of the resources that would work and be most appropriate for the layperson, there are professional agencies. Our firm, AM LLC, has a few opportunities that we can work with you to write grants, to advise with grants, to be a partner to whatever the specific initiative is that your agency has, or specific intervention that you're working towards. Grant Professionals of America, they are a clearinghouse of sorts for grant writers. They actually credential grant writers and are a really great mechanism to make sure that if you do hire a grant writer, that they're on the up and up. And through this hyperlink, you can see where they've sorted a lot of grants that allow you to pay for a grant writer as a part of the funding. Some are different. Many state associations have legal counsel and writers available for your assistance. And also federal agencies have anything ranging from a help desk to just general assistance when you're looking at some of those. I put a couple examples, Department of the Interior, Health and Human Services, FEMA. And then finally, once we're getting into how to do it, who's got it? The Fed right now is huge. That money is always there, rarely there with the ease and capacity that it is right now, but it's still a great time to start. Philanthropic organizations, the HIV/AIDS cause has one that comes to mind as having a lot of philanthropic organizations based around them. Special interest groups, maybe a wealthy individual had a child or a grandchild that lived life with a particular disability or burden on their life that they've since funded a grant for. Moving on and on in this list, and what Lori can touch on later, she's worked with some of these larger organizations and funders to let you know exactly what that is like. I think since I was told last time that I didn't make the sound happen, I won't do that to you again. So I would like to skip that because it's not going to have audio. And if you have taken a nap, I would request you kindly to please wake up now because you're to the good stuff. And Lori is going to regale you with some really great tips on getting some additional funding brought into your agency. Lori, it's all yours, ma'am.
Okay, thank you so much. If you can go to my first slide, please. There we go. So the title of this one is How Can AM Work with NACCHO and STLT Health Departments? And we do have a few documents that we can provide. In particular, we have an RFP and a grant writing guide that we could send to you. We have hyperlinks to two documents that describe some of our capabilities. One of them is a long-term care facility infection prevention and control document, and the other one concerns vaccine hesitancy. Next slide, please. I borrowed a beautiful NACCHO graphic here, just describes how federal funding reaches local health departments, basically Congress to CDC, to the state, to NACCHO and STLTs. And NACCHO also provides wonderful resources for finding funding opportunities. So I put those two links there. You may have already seen those, but I wanted to summarize this in case anybody was interested. Next slide, please. This is another wonderful NACCHO funding graphic. And if you look to the right, you'll see the list of federal agencies that support each of these programs: emergency preparedness, immunization, injury and violence prevention. And when I looked at this, I looked and saw CDC on each line. But one federal agency that I didn't see was the National Institutes of Health, the NIH. So next slide, we'll probably talk a little bit more about the NIH. A broad overview of the Health and Human Services, HHS. They're the largest grant-making agency in the US, and most of the grants are provided to states, territories, tribes, educational and community orgs, and then given to people and organizations who are eligible to receive the funding. There are 11 divisions, and HHS includes CDC and those listed on the previous slide, plus the National Institutes of Health, or NIH. Next slide, please. NIH and grants.gov. There are 27 NIH institutes and centers. Some people have heard of the National Cancer Institute. That's the institute that I worked with when I was at the NIH. Everyone knows Dr. Fauci now. Dr. Fauci is the director of NIAID, the Institute of Allergy and Infectious Disease. And Dr. Fauci's boss at the NIH is Dr. Francis Collins. And he is a specialist in genes and genetics, and he was one of the people that helped push forward the sequencing of the human genome. I have listed here, there's a really cool tool that I've used for many, many years. It's called the NIH Reporter, and you can just search on NIH Reporter and that will pop right up in your Google search. And I like to go in there and look at recent awards because you can put in keyword searches, say you're looking at HPV vaccinations or something like that, and it will pull up the abstracts and the monetary amounts for recent awards. You can look according to year, you can look according to state, you can do all kinds of searches there. And part of the strategy that I've always used is I look at these abstracts and I think, well, Dr. Fauci's group just funded, this particular project. How could I possibly make mine a little bit better? Or do I have more of an urgent need in my community that would make it compelling to the reviewers? So I definitely recommend NIH Reporter. And many of you have probably looked at grants.gov. You can search for grants and cooperative agreements. And a cooperative agreement is similar to a grant, except that the NIH likes to have a little bit more, or the other federal agencies like to have a little more input. They want to make sure that you definitely succeed. And so that's why it's called a cooperative agreement. I've done both and they're very similar actually. I did a search yesterday and I put in a limit to HHS and eligibility of only small business, city, township, or county governments, and unrestricted. That's a field. Unrestricted means that anybody can apply, including individuals. And so there were about 1,000 where small business, city, township, or county governments were eligible to apply. And many of those overlap, but there are quite a few in there. Next slide, please, Chris. In thinking about some example research projects, what came to my mind is, and having worked with some of this data before, I bet you all have heard about the BRFIS and the URBIS. This is the behavioral risk factor surveys that the states do, and they compile the data for the CDC. You can search CDC Wonder to look at all of that data. And that's the adult, and the other one is the youth survey. And we are, as a company, or anyone can request de-identified data after approval through the state departments of health. And so another thing we can do is we can look at publicly available data. And I'm sure you're aware that that's much more available now due to COVID-19. And possible ideas for projects would be to do unique analysis, to stratify to different highlights, to highlight areas of concern such as demographics and social determinants of health, and then to produce publications and reports. Next slide, please. Another idea would be to do gap analysis and analysis of weaknesses and to do modeling and prediction. And AM actually presented a webinar with NACCHO on April 15th, 2021 concerning workforce analysis. And I have a slide, and you'll see that next from that presentation. So if anybody missed that presentation or you'd like more information, we'd be happy to provide that as well. But as you know, the case investigation and contact tracing staff has fluctuated a lot, and sometimes those staff needed to be redeployed to other areas. That was one of these predictive models that might help. And another example is that staff turnover in long-term care facilities during the pandemic, many long-term care facilities hired unemployed folks from the food service industry. And then after, when vaccinations became more available, the folks returned back to food service jobs, and some report up to 100% annual turnover in staff. So, and this is the slide from the April 15th presentation, and it just shows some of the analysis tools that AM can provide. I didn't think I'd dwell too much on that, but please contact us if you're interested. Next slide, please. So in general, COVID-19 has allowed many data and reporting processes to be expedited, but working directly with health departments would allow for even more expedited results. And the funds go to areas typically with higher rates and urgent needs. And some examples, and I'm sure there are many, and you all know of these very well, but I put a few here: the high opioid overdose deaths, substance use, depression, infectious and chronic diseases, health disparities, demographics, and the vaccination concerns. Okay, next slide, please. So we're all hoping that the CARES Act and other funding will open up more opportunities for us to work together. And depending on the funding terms, AM or the health department might be a prime contractor with subcontractors and partners accordingly. One example was this NOFO that Chris described, and it was a national initiative to address COVID-19 health disparities. And the CDC really reduced the burden for applying for this, and they made it non-competitive. And 107 awardees were recently announced. And the nice thing about this too was local businesses were allowable as partners, and they just had to be listed on a spreadsheet. They made it very low burden. And we did provide in the lowest, the hyperlink at the bottom. This is the PDF of how much money went to each state Department of Health and the 107 awardees. And it also lists the amount of rural carve-out funds that went to the 107 awardees. So I think that would be a really interesting list if you haven't seen it yet. And interestingly to me, when I looked at this, New York State was, I believe, the only state that had a nonprofit entity to handle the funds and to distribute them. So I wondered why other states haven't done that. Okay, next slide. This is an example NIH cooperative agreement that is active that I was able to find. It's an emergency award, social, behavioral, and economic research on COVID-19. STLT health departments and small businesses can apply. Both are eligible. The next round is due November 9th, and it's $500,000 direct costs per year for up to 5 years. And I'll just read this to you. The FOA aims to form a research consortium to access, extract, integrate, share, and analyze existing data from various sources with broad population coverage, including underserved and vulnerable populations. And examples of data include public health data, some other things listed there, and then at the end, ongoing health, demographic, and social surveys. So those of you who have been involved with some of these surveys know that you can put in different modules and address different urgent needs that might be in your local area. And the link to that particular FOA is provided there as well. So that's one example. Next slide, please. So Chris summarized some capabilities that AM offers, and I thought I'd list a few more here, and I won't take the time to read these, but hopefully you can look at the list and maybe contact us if you think that we might be able to collaborate or help in any way. In general, it's responding to COVID-19 and other situations, coordination of projects, and preparation for the future. And next slide, please. That is our finishing slide. So I think we'd be open to any questions that you might have.
Absolutely. I had two quickly, Lori, as we went through some of those terminology pieces.
Yeah.
Would you mind sharing with folks what the STLT stands for?
Oh, state, tribal, local, territorial. That's a CDC term. I didn't make up that acronym.
You did not make it up, but it was another one because there's two T's, and I thought, wait, no, there, I don't know where that one goes. And then a piece that I wanted to tie our two thoughts together on was the NOFO from CDC, that there were only 107 participants in that. Just to contextualize that for you, that's an average award of $21 million to those 107 people. That was $2.25 billion with a B, and only 107 people applied for it with an average award of $21 million. So I wanted to share that so that, you know, when you see things like that, even if you're at a loss, call somebody, call us if you have to. We're all in this together as the face of public health, trying to elevate that in our nation and beyond. So I just wanted to put those two. Dominic, how would you like Lori and I to take questions?
I'm happy to pose them to you. We have a question from Julia Grace Sanders. What methods do you suggest to find grant opportunities?
I always start with grants.gov, and I put in my eligibility. For example, if I'm a local health department, I will start that, and there's a little sidebar where you can put in eligibility, and it can be overwhelming. There are so many there. So for example, if you think you're looking for NIH or CDC, select the criteria HHS for Health and Human Services. And that can also be a little overwhelming because the CDC, I think they have about 10 or 15 categories in CDC. But start out by doing an overall search. And if there are too many, then you can just narrow it down. But that helps a lot, knowing that you're eligible to apply.
That is fantastic.
Chris, I was going to say something about that NOFO, and we did provide the link for that PDF of the awards. They definitely have the amounts listed for rural carve out. I don't know how that's going to be distributed, but we were told in a CDC webinar that the local folks should contact their states to find out if that helps.
We do have another question. Do you have a newsletter, or do you send out grant opportunities when they're listed?
So as far as a newsletter, no, we try to send out everything via social media. So the very easiest way is, I would suggest following on any of the platforms. Ms. Gullahorn on our team is amazing at making sure everything is out. Really on whatever your flavor is for social media. We're on Instagram, Twitter, Facebook, YouTube, LinkedIn. That may be it. I'm not as cool as my kid would like me to be, but I think it's one of those platforms, and we would share that way. If there's enough interest in that, that seems like something completely reasonable that we could do. Somebody maybe with Lori's expertise that could take that overwhelming filter and just pop a hyperlink out or something, maybe on a weekly basis. I think that would be awesome. I think Julia asked that one. Yeah, why don't we? I think, Lori, we could make that happen, huh?
I would think so.
Yeah, we can do that. Great question.
We have another question from Jeannie Donovan. Are you aware of any existing or forthcoming ARPA funds or grants that are specifically targeted toward local health departments?
I'm not aware. That would be something that I would have to search on, and I could follow up and do that to help out if you'd like.
Sure, that would be helpful.
Okay.
Our next question comes from Jesus Medina. You mentioned businesses are eligible to apply for grants. Do they have to be nonprofits or any small businesses eligible?
You know, that's interesting. It's a little bit complicated. For example, the federal agencies that support this small business innovation research project programs, those are really set aside only for small businesses. But they tend to be things where people might have a new process or service or technology. Now, you can go in there and search on small businesses as far as the eligibility criteria, and you will pull up a lot of different grant opportunities. I look at this like it's always better to have a partner, though. If you're looking, just because you're eligible to apply doesn't mean that you will be all that competitive. I think that the government loves multidisciplinary and and collaborative projects between more than one entity, because they're harder to do, but the results tend to be better. And so you're eligible to apply, but I think it's better if you have an academic partner or any kind of partner, even if it's more than one health department with a small business. So,
Lori, would this be a spot where you might recommend some of the more cooperative type arrangements, maybe through NSF with their seed fund, or some of those that more spell out what they would like?
yes. So the National Science Foundation tends to be educational grant based. And so, for example, you could propose, let's say AM were to work with a Department of Health. Potentially the collaboration could be the small business would utilize some of that data that's collected at the Department of Health, and we might do a modeling kind of predictive algorithm or something like that to look at health disparities or where we could fine tune vaccine hesitancy or something like that. I hope that helps.
We do have a few more questions. Is there a place to check for NOFOs?
That's a good question.
I just learned what the word meant a couple months ago. That's there is, Lori, you can share with the.
That I've never searched on grants.gov for the term NOFO, but I would assume that would pull up as a keyword search, and I have not done that myself.
I have, and that is why I handed that one off. So whoever asked that question, don't let anyone make you feel silly for saying that. That is a keyword search that you can use through grants.gov. There are two government websites that I think are the most underrated in the entire world. When you're looking for a job, usajobs.gov, tremendous. And when you're looking for money, grants.gov, tremendous. And NOFO is a keyword search that you can use on there.
Oh, very nice, Chris. The NOCI is also something that came out because of the pandemic, and those were tough because those typically only what NIH did. They said, this is an urgent situation. We're going to supplement people, say they were working on an HPV vaccine. They were able to recompete and get supplemental funding very quickly through the NOCI program to supplement COVID-19 research. So.
And NOCI is NOSI?
Yes. Notice of Special.
NOSI.
I can't remember what the I stands for.
We'll find that out for you and put it in the chat box.
There you go.
We do have a few more questions. Do you know of any national foundations that focus on local health and COVID prevention efforts? Any list that can be researched in Foundation Center online, Morningstar, or other search engines?
Chris, you might have more information than I do. I know that there are, it's just the local area, and I feel like folks in the local area might know more than myself because it is so locally directed.
I think what would help maybe provide the best response would be what exactly you were looking for the funding to do within that, because there are several that come to mind. So if you want to drop me a quick email on that, I'm happy to respond with a list of who I think could be useful for that. Maybe if you want to just expand just a little bit of really what you're hoping to collect out of those resources, because the short answer is yes, there are a ton of those, and a lot of this money is expiring, and it needs to be spent, as insane as that sounds. There's a lot of money that needs to be spent very quickly. So I'd be happy to answer that question if you'd like to send me an email.
Great.
We have time for one more question. How would a partnership with a local, new, so never been funded nonprofit group for disparities in health, education, social, human services, research, etc., and a health department be received? And any key places online that would best serve such a purpose?
Yes, so I think there is a national consortium of nonprofits, the NPF. I would suggest you start there. And one thing I could not stress enough is that within those in your community that are passionate about starting this nonprofit with you, if you can get anyone that is licensed to practice law in your jurisdiction, having an attorney will be indispensable. There are online tools that will claim, and I'm sure to some extent rightly so, that they can help you incorporate anything you need. The Sarbanes-Oxley, which you'll hear referred to as SOX quite often, is the set of laws that regulate nonprofits. Those are very, very detailed, and you can wind up on the wrong side of the IRS if you're not careful when you're founding these types of things. So I would encourage that, and I think those types of endeavors are generally received very well. I would probably have at least your wireframe of who you think might join and what you think you would like your first project to be as the nonprofit, and then set up a meeting with the leadership of that local health department and ask if they would sign on as a recipient, because you will need someone to be a dedicated recipient of your work in most states to receive formation at a federal and state level. So have a task, have a wireframe, and then approach your local health district would be my suggestion in that order. And then from my experience, they've been received exceedingly well.
We're at time today. I want to thank Chris and Lori and our partners at AM Trace for this terrific information that was so informative. I hope that you found it as useful as we did. As I mentioned earlier, I will be sending out the recording link, the slides that were shared, as well as the video link that we weren't able to hear earlier later today. So you'll receive that. And if there are any questions, please feel free to reach out to NACCHO, membership@naccho.org, or contact AM Trace through any of their social media volumes that are there. And we'll also include an email address along with that for you to contact them. Thank you for the feedback. We're glad you found it felt well informative, well presented. I found it the same as well. And we'll meet with you soon. Stay safe, everyone. Thank you.
Thank you all. Take care.
Thank you.
Yes, Lisa, we will share a copy of the webinar. Bye, everyone.